I'm Janelle Stelton-Holtmeyer, Associate Editor of Modern Distribution Management, and I'm talking with Lars Parkin, broker at Bliley Insurance Group in Boulder, Colorado. Bliley Insurance helps administer and consult small businesses on benefits and keeping compliant with legislative changes in employment law as it pertains to those benefits. So, Lars, healthcare reform. With the passage of the package last year, the debate continues, and there's a lot of misunderstanding about what's happening. So, what is happening with healthcare reform and regulation right now? And are there any specific misconceptions that you think are coloring the conversation?
Yes, it's an excellent question. The passage of the Healthcare Reform Act was pretty momentous. It did change the landscape of employee benefits and health insurance within the country to differing degrees to different businesses and different individuals. It certainly is not a government health insurance plan, as many people thought was coming. So the misconception is that there's a government health plan for businesses. There is not. Other simple misconceptions are that there are requirements upon the employers to make changes immediately to their plans. That's also not the case with grandfathering provisions and the like. But I think some of the biggest misconceptions are that there was a feeling from the public that now all pre-existing medical conditions are covered. Now, for children under the age of 18, that is the case. But for any adult, that will not be the case until 2014. So often when calls come into my office from groups and for individuals, it's to answer that misconception particularly. It's a messy process. The bill itself was, I believe, around 2,700 pages. I read most of it. The regulations, when they're going to be completed, are estimated to be around 30,000 pages. And from what I've heard, they're only about halfway through creating those regulations. The Health and Human Services Department, of course, is in charge of that, and Sebelius is in charge, and they are slogging their way through it. But that process is slow. They've already reversed a number of regulations that they initially wrote, and so communications to employers and individuals has been ongoing for someone like me, an independent broker and consultant, letting people know those changes are taking place. It's hard to stay on top of it.
What are some of those regulations that have already been overturned?
Some have been overturned and some just delayed. So notably, there was a 1099 reporting requirement within the Healthcare Reform Act. That is, if you as an individual or you as a business entity spend more than $600 in goods and services with any entity or individual, you have to issue them a 1099 at the end of the year. Obviously, it's a means to create a mechanism to track taxable transactions more clearly. But the harsh reality is that the paperwork involved was going to be tremendous. The CPA and accounting firms and payroll companies were the ones that actually voiced the most opposition, saying they're just not ready to do that. And let's put this in perspective. I probably spend more than $600 a year at Starbucks. I would have to issue Starbucks a 1099 as an individual for the goods and services I received from them in the course of the year. It just doesn't make sense. So, it's delayed. So instead of being enacted in 2011, at this time, you're going to have to start doing that in 2012, unless they reverse that, which they could very well. So that was probably one of the primary ones that, when you shake the tree, logic sometimes falls out. Another particular issue that has been reversed or delayed in some degree are the new eligibility guidelines for small employers, their discrimination testing within their health insurance contracts. For example, you have a company of 20 employees, and you tier your benefits where management receives one level of benefits and the staff maybe receive another or none. Other than keeping a grandfathered contract, or if you were going to write a new contract, you would have to follow the new eligibility rules under federal healthcare reform, which basically didn't allow that. It is illegal to have any tiering of benefits. It also redefined what is full and part-time. Previously, as an employer, you could say 40 hours on average is to be considered eligible for the group plan. Well, for health insurance under the Healthcare Reform Act, it's 25 hours. And that's a big impact on some smaller businesses that maybe have employees at 30 hours or 25 and aren't currently shouldering the burden of the premium for that kind of thing. So that was delayed until they could get a little more clarification on how to do that in a non-discriminatory fashion. So the testing of that, and that testing to see if it's discriminatory or not, was going to match how 401ks did their testing. That has also been delayed at this point. But That's one that we don't believe is going to be reversed. We believe that that's going to probably be enacted and the regulations will be written. So we will need to follow those rules, and that's a little bit scary. So certainly a big impact on the industry.
Are there any other things that these changes specifically mean for businesses, particularly the small businesses?
Yes, and forgive me if this sounds a little self-promoting, but I think the necessity to have a consultant or a broker help a business owner understand what their liabilities are, not just now, but in the next 3 years, is more important than ever. So it's important that a small business owner, if they have a group benefit contract in place now, they connect with their broker or their representation to make sure that they're being compliant with the new grandfathering rules and the like. Of note, in 2014, a lot of things change within the health insurance markets. One of them is the way that group health insurance carriers charge premium based on the age of the employee. In 2014, we're going to go from what we currently call a 7 or 8 to 1 ratio, where someone who's 60-year-old or above pays roughly 6 or 7 times more than someone under 20 for the same coverage. So there's kind of an age band mechanism. In 2014, that will be smushed down to 3 to 1, which for most people that are older than 55 or so probably isn't a bad thing. But any employee that's younger than that may see rates actuarially double to get to that 3 to 1 compression. Now, if you have a non-grandfathered contract, which means you didn't keep what you have now, you will fall subject to that compression of ages. If you keep your grandfathered contract at this time, you avoid that and its impact. But it also means you're kind of locked into what you have for the next 3 years. And that's not necessarily a great thing either, the way the rates are raising. But that is a conversation that needs to be engaged and had for every small employer that has a group benefit plan in place.
So besides finding a broker, is there anything that businesses can do on their own in order to respond to some of these changes?
Well, the carriers, the insurance carrier that they actually have coverage with, have shouldered a lot of the burden when it comes to distributing information on healthcare reform and its impacts on coverage. Obviously, the insurance companies were the target of the majority of the changes in the Healthcare Reform Act. So as they go through changes, they're required to notify their insurers of those things. So where in the past it was kind of easy to look at something coming from an insurance company like a piece of junk mail, as most of us would, probably more important than ever now to look at what they're sending you and take note of if they're going to make any changes to your plan and rates particularly. But those would be probably the first 2 resources. By all means, they can go to the Health and Human Services governmental website. But like most governmental websites, you could take hours going through that just to pick out a particular sentence or 2 within a regulation. Again, best work with an independent consultant to help you with that. If not, get through your insurance carrier's materials to see what they have there for you.